We all want our children to be healthy now and in the future. We want a healthcare system that effectively supports their health and is accessible to British Columbians across our vast and diverse province. There are two challenges we face to accomplish this goal. The first challenge that we must overcome as we plan and consider health services, whether it's for children or adults, is the vastness of our BC geography. In BC, we have approximately 1 million children and youth spread across approximately 1 million square kilometers. How can we provide the full range of services that are needed to maintain or enhance health when children are so spread out across the province? The second challenge is that children are a relatively small proportion of the population. In 2015, Statistics Canada published data showing that there are more adults over the age of 65 than there are children under the age of 15. If population trends continue, by the year 2035, seniors will outnumber children under the age of 15 by a factor of 3 to 2. So why is this fact an important challenge to recognize when thinking about health service planning? Children clearly make up a relatively smaller part of the population, but they are entirely our future. Our current state? Statistical data in 2017 showed that 109 hospitals and health centres provided emergency care to children in British Columbia. There were 75 hospitals that admitted children and youth for medical conditions, and 55 hospitals provided surgical care to children. Clearly, many health care providers, hospitals, communities, regions, resources, and ministries are actively involved in supporting children and their families to achieve the best possible health, and they are doing that in the context of the challenges we have already highlighted. Given that children's health in BC requires collaboration and partnership, Child Health BC brings together stakeholders from across BC for a bold common goal: to work together to continuously improve the health status and health outcomes of BC's children by building an integrated and accessible system of service. BC needed a consistent framework to truly create an accessible system of health services. Our approach is called the Tiers of Service, and it provides a common language and method for defining and planning health services in BC. It facilitates system planning for clinical services, for training and sharing innovation and new knowledge, and for enabling quality improvement and research. Through the tiers of service, we clearly outline our responsibilities in meeting the service needs of our children and what the system requires in terms of resources to meet those responsibilities. In considering how to develop the tiers of service approach, we studied the published literature about system planning and reviewed the work of other jurisdictions, including the UK, Australia, and others. Amongst the most useful was the framework and approach of Queensland, Australia. Queensland is geographically about the same size as British Columbia, with a similar population size and economic status. From a health system perspective, through what they call their Clinical Systems Capability Framework, they have developed a tiers of service approach involving 6 tiers for their full health system to adults and children. We have adopted a similar approach more specific to children and youth with the Child Health Tiers of Service Framework. Services are categorized as Tier 1 through Tier 6. Tier 1 offers a wide breadth service to the entire population, and Tier 6 offers an in-depth, subspecialized, pediatric-focused service, often requiring multiple critical interdependencies. Each one of these tiers is important, and each tier has unique roles in serving children. The system as a whole functions best when all the tiers know and accomplish their responsibilities and fulfill their requirements. Tiers of Service Approach. For each of the major areas of health services, such as emergency care, pediatric medicine, and pediatric surgery, a Tiers of Service module has been or is being created. Each module has 3 parts. Part 1 is called Setting the Stage, and this presents available data and literature used to create the module. Part 2 is called Tiers in Brief, and is for system planning. Part 3 is called Tiers in Full and is for operational planning. Responsibilities and requirements are identified for each of the specified tiers in the module. Examples of responsibilities include major tasks, functions associated with the service, and tests, assessments provided. Examples of requirements include the resources required to perform the service at the specified tier, such as providers, facilities, and clinical, diagnostic, and support services. The tiers provide a guide to the responsibilities, requirements, and critical mass to provide a safe, sustainable, and appropriate level of a specified service. Once a module is finalized and accepted by the key partners in the province, a self-assessment is completed. The Tiers of Service self-assessment is an opportunity for stakeholders to assess their current state and identify strengths and opportunities with respect to those outlined in the module. Child Health BC supports our health authority partners as necessary to get this work completed. The self-assessment results are analyzed and validated. The results are then disseminated, and provincial, regional, and local planning is undertaken with significant efforts by our health authorities' collaborators, facilitated by Child Health BC. Together, we can achieve our goal of a strong system of service delivery that supports the best health for the children of BC. For more information about the self-assessment process, please watch our next video.